Hello everyone, hi, I'm Jewel and welcome. Welcome to my channel. Today's topic is chronic kidney disease and pneumococcal disease. Do you know the facts? This information is coming from the National Kidney Foundation, but before we get started, I would like to say Happy Columbus Day and Happy Indigenous Day to all the Native Americans of this country. Okay guys, let's get started. It is important to stay up to date with your vaccinations, especially if you have kidney disease, kidney failure, or a transplant. There are several vaccines that you need. One important vaccine that you may not know about is the vaccine for pneumococcal disease. What is pneumococcal disease? Pneumococcal disease is an infection caused by bacteria called pneumococcuses. It can lead to serious, possibly deadly illness such as pneumonia, meningitis, and sepsis, a blood infection. Anyone can get these diseases, but some people have a higher risk. People with the highest risk include infants, people 65 years and older, and adults of any age with certain health conditions such as kidney disease. You also have a higher risk if you are on dialysis or have had a kidney transplant. Why am I at risk for pneumococcal disease? Normally, your body fights off anything that isn't part of itself, like germs and viruses. That system of protection is called your immune system. Having kidney disease and kidney failure can weaken your immune system, making it easier for infections to take hold. In fact, doctors and researchers have found that most infections like those caused by pneumococcal disease are worse in people with kidney disease. People with kidney transplant also have weakened immune systems. That is because anti-rejection medicines, immunosuppressants, which protect the body from rejecting the transplanted kidney, suppress the immune system. The good news, getting vaccinated can help protect against pneumococcal disease. What are the symptoms of pneumococcal disease? Symptoms are not the same for everyone. They can be different from person to person. They can appear very suddenly and without warning. Depending on whether the infection causes pneumonia, sepsis, or meningitis, you may have some combination of the following: abrupt onset of fever, shaking and chills, cough, shortness of breath, chest pain, stiff neck, and disorientation. If you develop any of these symptoms, seek immediately medical help, call 911, or go to the emergency room. Why is this vaccine so important? It is important to have this vaccine because pneumococcal disease causes several different illnesses. Pneumococcal bacteria can get in the lungs and cause pneumonia. It can enter the bloodstream that they call, you can enter the bloodstream, and they call a certain infection called sepsis. They can also infect the covering of the heart. They can also invade the central nervous system and cause meningitis. Pneumococcal disease is dangerous and deadly. All forms of the pneumococcal disease can be serious, even deadly, but sepsis and meningitis are the most serious. People who survive either of these often face hospitalizations, long recovery time, devastating health problems such as hearing loss, seizures, blindness, and paralysis. Pneumococcal pneumonia is also dangerous. It causes death in 5 to 7% of people who get it. In some people, it can cause a heart attack or heart failure. You can get pneumococcal disease from a person who appears healthy. Pneumococcal bacteria live in the throat and spread through coughing, sneezing, or direct contact, such as kissing. Not everyone who carries the bacteria gets sick from it, so it's possible to catch pneumococcal disease from someone who seems to be healthy. People with kidney disease, kidney failure, or kidney transplant also need influenza vaccinations. Flu or influenza is also a serious infection that people with CKD need to be protected against. In addition, having influenza increases your risk of pneumococcal disease. So people with kidney disease need both influenza vaccines and pneumococcal vaccine. You should get vaccinated for flu every year, preferably before the flu season starts. The vaccinations remain useful throughout the season. Pneumococcal vaccines can be given at any time of the year. How often should I be vaccinated? There are two types of pneumococcal vaccines available for adults. Pneumococcal polysaccharide vaccine, which is PPSV23, and pneumococcal conjugate vaccine, which is PCV13. Adults with kidney disease, kidney failure, or kidney transplant need to receive both vaccines. Most healthy adults only need to be vaccinated one time, but some people at high risk, including people with kidney disease, dialysis treated patients, and people with kidney transplants, need to receive two pneumococcal vaccines initially, followed by revaccination in 5 years. Ask your doctor about your specific circumstances. Do children need protection against pneumococcal disease? Yes. Infants and young children in the United States need to be protected against pneumococcal disease. In fact, they are routinely vaccinated for pneumococcal disease because it is a part of the standard infant immunization schedule. Pneumococcal vaccine is also recommended for older children and adolescents with kidney disease, kidney failure, or an organ transplant, even if they received the vaccine as infants. If your child hasn't been vaccinated, talk to your doctor. Who else should get the pneumococcal vaccination? For adults, the Centers of Disease Control and Prevention, which is the CDC, recommends pneumococcal vaccinations for anyone 65 years or older, adults with any of these health conditions, chronic illness such as lung, heart, liver, or kidney disease, asthma, diabetes, or alcoholism, conditions that weaken the immune system, cochlear implants, cerebrospinal fluid, CSF leaks, and a splenectomy, loss of the spleen, and of course adults who smoke cigarettes. So everyone, this was chronic kidney disease and pneumococcal disease. Do you know the facts? Okay, guys, this article is pretty serious because pneumonia is very, very serious for anyone who gets it. And I have to tell you that I can speak to this personally because I got pneumonia a few years ago, and I have to tell you it was one of the scariest things that I've ever went through. And it scared me very, very much because, of course, it affects your breathing, and it's very, very hard to breathe with pneumonia. So, of course, it put me in the hospital for a little while. So, guys, I have to tell you, I didn't get the vaccination before, I had pneumonia. So, once I did get pneumonia, I got vaccinated. So, guys, I'm suggesting to all of you to please get this vaccination for pneumococcal disease because it could save your life. And it is very, very easy to become very, very sick with this disease. So, guys, if you found this information useful in any way, please like, share, and subscribe. And of course, I'm sending you so much love, so much affection, myself and every other CKD patient out there, and of course, all the organizations that are there for us and are there to basically lift us up in our health and our lives. So, guys, the only thing that we have to do, of course, is stay positive, stay compliant with our doctor's orders, Always, always be hopeful, guys, because we never know what's coming around the corner when it comes to a transplant or some different type of procedure that can help all kidney patients. But guys, we got to stay positive. So guys, take care of yourselves, and I will see you on the next video.